As I mentioned, there are 5 talks by 6 speakers, and today Alexa Norton is going to get us started. Dr. Norton now joined the Public Scholars Initiative as a PhD student in the Interdisciplinary Studies Department at UBC, working on safer supply. And there is a big story and lots of learnings behind it. And Dr. Norton now, working with the First Nations Health Authority and also University of Victoria, is here to share it with us. Alexa.
Good afternoon, everyone. I want to thank Derek Thompson first for opening and grounding us. Thank you for that. Before I start my talk, I just wanted to mention that I am talking about the toxic drug crisis, and that can be a tough topic, so please take care. On that note, I do also want to leave us with some hope. So, we are, as you know, living through a toxic drug poisoning crisis. This crisis isn't confined to Vancouver's downtown east side or to people living on the margins. This crisis really affects every single person in this room. It might affect us individually, it may affect our friends, our family, but it's close to our hearts. And unfortunately, this crisis has become the norm. And because of that, it can be a bit difficult to talk about solutions to it. We've been living through this crisis for so long that I think there's a sense of real exhaustion among people. But one thing that we can all agree on is that something really needs to change to turn the tide on this crisis, and we need to try new things. So, in 2020, in British Columbia, we tried something new, and we called it safer supply. So, safer supply is the practice of providing safe, regulated pharmaceutical alternatives to toxic drugs. And I want to pause here and ask you whether the phrase safer supply elicited an emotional reaction from you. If it did, we're going to unpack why. But first, so in 2020, feeling invigorated at the prospect of a new solution that might turn the tide on the overdose crisis, like any sane and reasonable human being, I decided to do a PhD. Flash forward to December 2025, and this is a representation of me at the end of my PhD, having lived through the brief but turbulent experiment of safer supply. What I want to talk about today is not actually my research or the evidence or the impacts, but my journey through this turbulent experiment. I want to talk about the forces that transpired to dismantle an emerging and promising intervention. And I want to talk about those forces because they have profound implications for health equity. So I'm going to tell you the story of safer supply, really short. During the pandemic, the calls for safer supply grew louder because we saw a real dramatic increase in toxic drug deaths. That being said, those deaths had been really high for years. So trying something new was certainly justified. We scaled up these safer supply programs across the province, and almost immediately they started showing some benefits. Clients reduced their use of toxic drugs, and I heard from people in my research some really profound improvements to their health and wellness. But there was a problem. Some people sold or traded their medications. And we knew that this was happening. This happens in a lot of prescription programs, but we didn't know how big of a problem this was or whether this was causing any harm. We actually still don't really know this. However, that did not stop politicians from weaponizing the issue or the media from sensationalizing it. And narratives were established that safer supply was linked to crime and social disorder. And while there's actually very little evidence to justify those narratives, Some people believed those narratives and were really impacted by them. So, amid news coverage and political pressure and changing public sentiment, prescribers grew a little wary of this intervention. Governments scaled back and closed these programs. And the people I work with, many of them were taken off of these medications, which is an incredibly destabilizing and dangerous place for people to be in a toxic drug crisis. So what I spent the last 5 years asking myself is, what the heck happened here, and why did this happen? And what I've come to is that we live in an era of misinformation and disinformation, short attention spans, and a lot of political spin. And at the same time, we are dealing with some really complicated problems, and the toxic drug crisis is just one of those problems. And as health equity advocates, if we're going to try new and innovative and sometimes controversial things like safer supply, we need to be prepared for what comes next. And I'm going to take a tiny sip of water. So fortunately, on my journey, I learned a few things which I think might be of some help. And the first thing I learned in my PhD is to literally be prepared for the unexpected. I did not expect this to happen with safer supply. But the reality is that there are some really strong forces. I believe Derek Thompson was just alluding to this or talking about this outright. Forces that really want to maintain the status quo and prohibit social change or inhibit social change and progress. And so something I learned that I think can help us to kind of counteract these forces is to engage in good communication. So the success of safer supply lives behind paywalled academic journals. It's not very accessible. And the failures were not reckoned with by government. And this left safer supply vulnerable to bad actors and political attack. The other thing I learned, which is probably on the minds of everyone in this room, is that there is no one solution to these big and complicated problems, especially the toxic drug crisis. Even though people benefited from safer supply when I spoke to them, they still talked about needing housing and opportunities for healing and recovery. They needed everything all at one time. Complex problems require sustained effort and investment. And as advocates, I think the onus is on us to build coalitions, to work across party lines, and to forge new partnerships with people we probably don't usually work with. In safer supply, this meant working with people who use drugs, but also for me, working with clinicians who both supported and vehemently opposed safer supply. I had a lot to learn from them. And so I think for us, the responsibility we have is to listen, to be practical, and to leave ideology behind. I want to return to the feelings you may have had when I first raised the concept of safer supply. Even I have feelings about safer supply. It's kind of hard to escape them. Sometimes feelings are created for us, not by us. There are bad actors and forces in this world that want you to feel anger and despair because it helps maintain the status quo and it prevents change. It stops us from enacting change. And so if you are brave enough to be a person in this room working on a solution to a complex and wicked problem, I want you to leave the room hopefully feeling empowered to try new, innovative, and even controversial things that some people aren't going to like. I think the onus is on us to do this because, from my perspective, it is absolutely unacceptable that we are losing this many people every day. And so for the health and well-being of not just people who use drugs, but our collective communities, I think it's on us to keep pushing this work forward and to work together. Thank you.